Imagine being a dedicated federal worker. Maybe you've been on the job for years, and then you sustain an injury that permanently affects your ability to earn a living. You probably know there are workers' compensation programs out there, right? But how do you actually get the benefits you're entitled to, especially when your injury isn't, a straightforward broken arm or something? Today, we're doing a deep dive into something really critical but often misunderstood in federal workers' comp. We're talking about non-schedule awards under the Office of Workers' Compensation Programs, OWCP. This area can seem pretty complex, I know, but understanding it can be a real financial lifeline for many of you.
Absolutely. And our mission today is basically to give you a clear roadmap through what can feel like a very intricate system. We'll unpack what non-schedule actually means.
Yeah.
We'll talk about which injuries typically fall into this category. We'll also detail the crucial medical evidence you're going to need, explain how the compensation is actually calculated, and importantly, highlight some common mistakes. Costly mistakes you'll want to avoid. And we're drawing on quite a range of sources here. Government sites like dole.gov, legal commentary, insights from specialized clinics that work with federal workers every day, trying to get you the full picture.
Okay, fantastic. Let's dive in and unpack this then. So to really get a handle on non-schedule awards, I think we first need to understand the difference between the two main types of OWCP awards for permanent injuries. First up, you've got what are called schedule awards. These are essentially fixed payments. They're for the permanent loss or loss of use of specific body parts that are explicitly listed in the law of the Federal Employees Compensation Act, or FECA. Think arms, legs, hands, feet, eyes. Even some specific organs get listed. So, for example, the law might say losing an arm entitles a worker to 312 weeks of compensation at a certain rate. The really key thing here is that these payments are fixed based on the body part and the percentage of impairment. It doesn't matter if that loss actually affects your ability to earn a wage. It's compensation for the physical loss itself.
Exactly. That's the crucial distinction. And that brings us to the other side, non-schedule awards. These are for permanent disabilities affecting body parts that are not on that specific list in the statute.
Yeah.
And this is critical. This includes injuries to your spine, your back, your neck. It also includes injuries to the head, brain, heart, and most other internal organs that aren't explicitly named in FECA. And here's the fundamental difference. For these non-schedule injuries, the compensation isn't some preset amount based on the body part, no. Instead, it's tied directly to the employee's loss of wage earning capacity, sometimes called disability compensation or wage loss benefits. It's about how the injury impacts your paycheck.
Okay, so let me try and simplify that just a bit for everyone listening. If the injured body part is on that specific schedule list, arm, leg, eye, you get a fixed payment based on the impairment percentage. Simple enough, right? But if the injury is to a part not on that list, like your back or your head or maybe your heart, then it becomes all about whether that injury impacts your ability to earn a wage. Let's use an example. Say a postal employee suffers a really severe lower back injury. Their back isn't on the schedule. So they won't get a schedule award just for having, say, a 10% impairment to their back.
Correct.
But if that back injury prevents them from doing their job, or maybe any job that pays as much, then OWCP looks at their wage loss. They calculate compensation based on that lost earning capacity. That distinction is just absolutely critical to grasp.
It really is. And building on that, let's be really explicit about what's excluded from schedule award eligibility. As mentioned, the back and neck are prime examples. But the law itself specifically names the brain, the heart, and the spinal vertebrae as not being eligible for a schedule award. So conditions like, spinal disc herniations, chronic back pain, head trauma, TBIs, even mental health conditions stemming from work like PTSD or depression. And most internal organ damage, too, unless it's one of the few specifically added by regulation like lungs or kidneys, perhaps. These don't qualify for that fixed schedule-based payment.
Right. I think I saw something about disfigurement awards for facial scarring, but that's different, right? It's not for the internal head injury itself.
Exactly. Serious facial scarring can get a separate disfigurement award, but that's distinct. It doesn't cover internal head injuries or mental conditions in the same way.
Okay, but here's where it gets, well, I think really interesting. You said these injuries are unscheduled, but sometimes they can actually lead to a schedule award. How does that work? That seems counterintuitive.
It does seem that way, but it's a really critical nuance. And honestly, it's something a lot of people miss, sometimes even doctors. Here's the thing. An unscheduled injury, like that back or neck injury we talked about, can cause a secondary permanent impairment to a body part that is on the schedule.
Ah, okay. Like a domino effect.
Sort of, yeah. For instance, maybe you have a neck injury that's unscheduled, but it causes permanent numbness or weakness or maybe loss of function in your hands or arms. Well, your hands and arms are on the schedule, so you could potentially qualify for a schedule award for the impairment to your upper extremities caused by the neck injury.
Gotcha.
Or, another common one, a severe back injury causes nerve damage that radiates down into your leg. Doctors often call this radiculopathy, that shooting pain, numbness, or weakness from a pinched nerve in the spine. If that nerve damage causes permanent impairment in your leg function, you could potentially get a schedule award for the leg, even though the initial injury was to the unscheduled back.
So the source is unscheduled, but the result affects a scheduled part.
Precisely. And this isn't just theory. Court rulings and ECCAB, that's the Employees Compensation Appeals Board decisions, have consistently backed this up.
Okay, so that makes sense. But I imagine the medical evidence needed to connect that chronically unscheduled injury to the secondary impairment in the scheduled limb must be absolutely rock solid.
Absolutely paramount. You can't just say, my back hurts and now my leg tingles.
Mm-hmm.
You need objective medical evidence. Things like nerve conduction studies, EMGs, electromyography, those tests that show nerve function. You need proof that the radiculopathy or nerve issue in the limb is directly linked, causally linked, to the accepted work injury to the spine or neck.
Right. Clear causation is key.
Always.
So it sounds like robust medical documentation is the bedrock of any OWCP claim, really, but maybe even more so when you're dealing with these non-schedule issues and potential wage loss benefits. And step one, always, is getting the underlying condition accepted by OWCP as work-related in the first place.
That's the foundation, yes. Once the condition is accepted, there are several crucial steps and documents that follow. First, your treating physician needs to determine when you've reached maximum medical improvement, or MMI.
MMI meaning that's as good as it's going to get.
Essentially, yes.
Yeah.
It means your condition has stabilized and it's unlikely to improve significantly further, even with more treatment. The doctor needs to state this clearly in their report, and importantly, they need to describe any lasting impairments or permanent work restrictions that result from the condition. Now, if that unscheduled injury did cause impairment to a scheduled body part, like the arm or leg examples, then you need a formal medical impairment rating, and this is non-negotiable. It must be done using the AMA Guides to the Evaluation of Permanent Impairment, 6th edition. OWCP switched to the 6th edition back in 2009, and that's the standard.
And who does that rating? Just any doctor?
Ideally, no. It's really essential to have qualified physicians do this. Specialists like orthopedic surgeons, physiatrists, neurologists, who are not only experts in the injury type, but are also familiar with the AMA guides and federal requirements. Accuracy here is absolutely crucial for getting the correct schedule award calculation.
Makes sense. And what about for the pure non-schedule wage loss claims? What's the key documentation there?
For those, the doctor's medical narrative is probably the single most vital piece of evidence beyond the initial diagnosis. This narrative needs to be thorough. It should detail the diagnosis, the history of the condition, the treatment provided, objective clinical findings, but most importantly, it must clearly outline any permanent work restrictions or functional loss.
Yeah.
The doctor can't just say patient can't do their old job.
Right, needs more detail.
Way more detail. They need to explain how the injury specifically impacts the ability to perform job duties or any work. If it's a heart condition limiting you to light duty, what exactly does light duty mean? No lifting over 10 pounds, limited walking, no stressful situations, and are these restrictions permanent? The doctor needs to state that and provide clear medical reasoning linking the findings to the restrictions. This detailed, well-rationalized narrative is absolutely essential for OWCP to make a loss of wage earning capacity, or LWEC determination.
Okay, LWEC determination. Let's pause there. Can you briefly explain for our listeners how OWCP actually figures that out? What's the process?
Sure. The LWEC process is basically how OWCP quantifies your disability in terms of earning power. They compare your established wages at the time of injury, what you were earning before you got hurt, to what they determine you're capable of earning after the injury, given your permanent restrictions.
How do they figure out what you can earn now?
Well, if you are working in a different, perhaps lower-paying job, they might use those actual earnings. But if you're not working, they often conduct a vocational assessment or a labor market survey. They look at your skills, your restrictions, and identify jobs that theoretically exist in your commuting area that you could perform. They assign a wage to that theoretical earning capacity. Sometimes you'll hear this called the Shadrick formula. That's just the established method OWCP uses for this calculation.
Okay, the Shadrick formula. Got it.
And a couple more crucial points on evidence. For these long-term wage loss benefits, you'll likely need ongoing medical evidence. You have to keep proving that the condition still disables you and still impacts your earning capacity. It's not usually a one-and-done thing. Also, you should be aware that OWCP has the right to send you for an independent medical examination, or IME, with a doctor of their choosing.
Ah, the IME.
Yes. And a final warning here, because it's a common pitfall. A weak narrative from your own treating doctor is frequent reason claims get denied or wage loss benefits get reduced. If the doctor just writes a short note saying can't work, without detailed medical reasoning, without objective findings backing it up, OWCP will likely reject it. The medical reports must be, as OWCP likes to say, well rationalized.
Well rationalized. That sounds like the key phrase. So once all that evidence is in, how does this translate into actual money, into payments for the injured worker?
Okay, let's talk dollars and cents. If the injury leaves you unable to work at all, you're looking at wage loss payments, often called temporary total disability or TTD, even if the condition is permanent. In that case, OWCP pays 66 and 23% of your gross pay at the time of injury if you have no dependents. Or if you have at least one dependent child, it bumps up to 75% of your gross pay. And importantly, these OWCP wage loss benefits are generally tax-free.
Tax-free? Okay. Can you give us a quick example?
Sure. Let's say your average weekly wage before injury was $1,000. If you're totally disabled and have a dependent, OWCP would pay you 75% of that, which is $750 per week, tax-free.
Okay, that's for total disability. But what if you can still work, just maybe not at your old job, or you're earning less? That's the LWC scenario, right?
Exactly. That's where permanent partial disability based on loss of wage earning capacity comes in. OWCP uses that formula we talked about often, the Shadrick formula, to determine your post-injury wage earning capacity. Let's use that $1,000 per week pre-injury wage again. Suppose OWCP determines, based on your restrictions and maybe a labor market survey, that you now have the capacity to earn $600 per week.
Okay.
Your wage loss is the difference. $1,000 minus $600, which equals $400 per week. OWCP then pays you compensation based on that difference. So they'd pay 66 and 23% of the $400 loss if no dependents, which is about $266.67 per week, or 75% of the $400 loss with dependents, which is $300 per week.
And that $600 capacity, that could be theoretical even if I'm not actually earning it. You mentioned a constructed LWEC.
Yes, that's a really important point. OWCP can construct your wage earning capacity. They might identify a type of job they believe you can do, find out what it pays in your area, and use that wage to calculate your LWEC, even if you haven't actually found or taken such a job. This is a common area of dispute, actually.
Yeah, I can see how that would be. Now, duration. We said a schedule award is for a fixed number of weeks. What about these non-schedule wage loss payments?
Big difference here. Non-schedule wage loss payments based on LWC generally have no fixed end date. They can continue for as long as you remain disabled due to the work injury and continue to suffer that loss of wage earning capacity, potentially for life.
Wow. Okay. That's significant.
It is. But this also raises a really important practical question for many federal workers: concurrent benefits and elections. Can you get different types of benefits at the same time?
Good question. Can you?
Generally, no, not for the same injury concurrently. You typically cannot receive a schedule award and wage loss compensation for the same injury at the same time. If you become eligible for a schedule award while you're receiving wage loss payments, you usually have to make an election. You'd pause the wage loss payments, receive the schedule award, which might be paid out over weeks or sometimes as a lump sum if OWCP approves, and then you could potentially resume the wage loss payments afterward if you still have an ongoing loss of earning capacity.
So it's not like you get double pay. It's not extra money on top.
Definitely not. It's an either situation at any given time for the same injury. Think of it as choosing which benefit stream you want active. Also, it's worth noting you usually can't receive OWCP wage loss benefits concurrently with federal disability retirement benefits from OPM, the Office of Personnel Management. You typically have to choose one.
But schedule awards can be paid alongside federal retirement.
Yes, that's generally true. Schedule awards are seen as compensation for the physical impairment itself, not wage replacement, so they often can be received concurrently with a federal retirement annuity, whether it's regular or disability retirement. One more interaction to be aware of: the Social Security Disability SSDI offset. Receiving an OWCP schedule award, especially if paid as a lump sum, can sometimes reduce your SSDI benefits for a period. The rules are complex, but it's something to be mindful of if you're eligible for both.
Wow, lots of interactions to keep track of there.
Definitely. And one final, very crucial warning related to benefits. If you are receiving permanent disability benefits, whether total or partial wage loss, and OWCP offers you a suitable job, meaning a job that fits your medical restrictions and qualifications, and you refuse it without good cause, OWCP can terminate your compensation entirely.
Terminate everything.
Everything, including forfeiting any potential future schedule award you might have become entitled to later for that injury. It's a very severe penalty for refusing suitable work.
Okay, that's a stark warning. And it feels like a good transition into talking about common mistakes. This is clearly an area where federal workers can easily get tripped up. Let's shine a light on some of those common pitfalls. I think mistake number one has to be just assuming every permanent injury automatically yields some kind of cash award, especially if you're familiar with, say, some state workers' comp systems or personal injury lawsuits. FECA, the federal system, is different. It generally doesn't pay lump sum whole person impairment awards for unscheduled conditions just because they exist, and it definitely doesn't pay for pain and suffering. So having a permanent chronic back injury, for example, doesn't automatically mean you get a settlement check if that injury doesn't actually impact your ability to earn wages.
That's a huge one. People expect a payout for the injury itself, and for unscheduled parts, it's just not how FECA works. It's tied to wage loss.
Right. And building right on that, mistake number two is filing for a schedule award for an injury that's clearly unscheduled. You see workers, understandably confused, applying for a schedule award specifically for their back injury or their neck injury or maybe even a psychological condition like PTSD.
And it gets denied.
Right. It's going to be denied because those body parts or conditions simply aren't on the statutory schedule list. The proper path, if there's an impact on earnings, is to pursue wage loss compensation, not a schedule award for the back itself.
Exactly. But what's fascinating here is the flip side of that coin, which leads to mistake number three. Not recognizing when a schedule award is actually possible, even when the main injury is unscheduled.
Back to that secondary impairment point.
Precisely. So many workers, and sometimes even their doctors, completely miss potential opportunities here. That primary unscheduled injury, the disc herniation in the back, the neck problem, might be causing real, measurable, permanent impairment in a limb, like foot drop from nerve damage or reduced grip strength or chronic radiating pain with objective nerve findings. If you have those symptoms in your arms or legs stemming from a neck or back injury, you should be asking your doctor about an impairment rating for the affected limb under the AMA guides. Don't leave potential schedule award benefits on the table just because the initial injury was to the spine.
Good advice. Really explore those radiating symptoms.
Definitely.
Yeah.
Okay, mistake number four is a huge one we touched on earlier. Inadequate medical evidence to support disability or restrictions. This is probably one of the most common reasons for denial of wage loss benefits or reduction of payments.
What does inadequate look like in practice?
It could be several things. Maybe the doctor just doesn't clearly state the permanence of the restrictions, or the restrictions listed are vague, light duty isn't enough. Or, crucially, there's a lack of objective support for the restrictions claimed. Remember, pain alone, while very real, often isn't enough for OWCP. They want to see objective clinical findings, diagnostic test results, things that demonstrate the functional loss. And the doctor's report might fail to properly address causation, especially if you have pre-existing conditions. The narrative needs to clearly link the work injury to the current disability and restrictions. It needs to be that comprehensive, well-rationalized medical narrative we keep talking about, tailored to OWCP's specific requirements.
That well-rationalized narrative, again, it sounds absolutely critical.
It is.
Okay, two more quick but crucial mistakes, focusing on timing and compliance. Mistake number 5. Applying for a schedule award while you're already receiving wage loss compensation. We covered this, but it bears repeating. These benefits usually can't be stacked for the same injury at the same time. You need to understand the election process and time things correctly to avoid overpayments or interruptions in your benefits. Talk to OWCP or get advice before trying to claim both simultaneously.
Good point. Coordination is key.
And finally, mistake number 6, echoing that stark warning from earlier. Ignoring OWCP's return-to-work efforts or vocational rehabilitation programs. If OWCP identifies suitable light-duty work with your agency or enrolls you in vocational rehab to find a new job, you have to cooperate.
You really do.
Refusing suitable work or failing to participate in good faith in vocational rehab that can lead to the termination of all your OWCP benefits related to that injury. We're talking wage loss, medical coverage, and even, as you said, any future schedule award entitlement. It's the ultimate penalty in the OWCP system.
Absolutely. Case law is very clear on that. So the bottom line for avoiding mistakes, it really comes down to understanding which benefits you might be entitled to, schedule award, wage loss, or maybe both sequentially, and knowing the specific rules and documentation requirements attached to each. Federal workers' comp definitely has its own unique set of quirks.
It certainly seems that way.
Oh,
And
yeah.
given all this complexity, the different award types, the critical need for specific medical documentation, the potential pitfalls, it really highlights the need for expert help. Where can federal workers turn when they're navigating this? It seems like having the right medical provider is key.
It's absolutely crucial. You really need medical providers who don't just understand medicine, but who specifically understand the federal workers' compensation system, OWCP's rules, and the types of evidence they require. So you should look for clinics or doctors who specialize in treating injured federal employees. They offer expert evaluation and diagnosis right from day one, already thinking about OWCP requirements. Critically, they should have specialists who are proficient, ideally certified, in performing impairment ratings using the AMA Guide, 6th edition. This ensures your schedule award evaluations are accurate, defensible, and maximize what you're entitled to.
You mentioned a clinic earlier, Restore Muscle and Joint.
Yes. For example, a clinic like Restore Muscle and Joint, which has locations in Kansas City and St. Louis, is a good illustration. They have physicians, like Dr. Kendra Pearson, who are actually certified in using the AMA Guide's 6th edition specifically for these ratings. That kind of specialization means they know how to produce the detailed medical documentation. OWCP needs those thorough, well-rationalized reports and narratives that clearly establish the diagnosis, the causal link to work, and the specific permanent work restrictions based on objective findings. They mention a high acceptance rate for initial claims, likely due to this meticulous approach.
And it sounds like it's not just about the initial evaluation, but ongoing support too.
Exactly. Good specialized clinics offer guidance through the whole OWCP process. They help patients understand the deadlines, the different forms, the CA1, CA2 for reporting the injury, the CA7 for claiming compensation, the CA17 duty status reports. They help you avoid those common pitfalls we discussed. Some may even assist if you need to file for reconsideration or appeal a denied claim. And having ongoing support in case management. Someone coordinating care, tracking progress, communicating effectively with OWCP, and maybe your employing agency that can make a huge difference in a complex case.
And you mentioned they're certified by federal injury centers. Does that help them stay current?
Yes, affiliations like that usually mean they're committed to staying updated on the constantly evolving OWCP rules, procedures, and policies, which is vital in this field. So connecting this to the bigger picture, the legal landscape court decisions and ECK precedents really help solidify and clarify these rules over time.
How so? What are some key takeaways from case law?
Well, for one, the courts have consistently affirmed the exclusivity of the schedule, meaning the list of body parts in FECA is it. You can't get a schedule award for something not on the list, like the brain, heart, or back itself. There are no whole person impairment awards like in some other systems. That's very firmly established. But, as we discussed, decisions like a notable 2022 ECCAB case involving the Postal Service have reaffirmed that spinal conditions causing documented radiculopathy in a limb can absolutely justify a schedule award for that limb, even if there's some pre-existing degeneration. The key is proving the work-related injury caused or aggravated the condition leading to the current limb impairment. Again, it comes back to that strong medical evidence.
Okay. Any other interesting legal points?
Couple, yeah. There are specific rules around modifying loss of wage earning capacity, LWEC decisions. Once they're formally made, it usually requires a material change in medical condition, successful vocational rehab, or proof of error in the original decision. However, there's also precedent allowing for temporary adjustments in payments if, say, an employer can't provide approved light duty for a period without formally reopening the whole LWEC calculation. And reinforcing our earlier warning, legal precedent is rock solid that refusing suitable employment terminates all future OWCP compensation for that claim, including any potential schedule awards. Numerous cases uphold this. There are also specific clarifications for things like hearing loss, vision loss, neuropathies, which generally require objective evidence like EMGs and confirmation that purely psychological conditions are not compensable under the schedule award provisions.
And the AMA Guide's 6th edition use is consistently upheld.
Yes, OWCP's use of the 6th edition since 2009 is the established standard.
So wrapping this section up, it sounds like staying informed about these rules and precedents and meticulously documenting everything is critical. Small errors or omissions in that medical narrative can have really significant consequences down the line.
Couldn't agree more. Precision matters immensely.
Okay. So after this deep dive, what does this all really mean for you, the federal employee navigating a potential injury claim? I think it shows that dealing with OWCP non-schedule awards isn't simple. It's really a journey that demands precision, a good amount of patience, and truly persistent, detailed documentation. It's not a system designed for quick settlements based on pain or inconvenience. It's fundamentally designed to compensate you for your documented lost weight earning capacity resulting from an unscheduled injury. And in those specific cases we discussed, for the permanent functional loss to a scheduled body part, even if caused by an unscheduled injury.
That's the perfect summary. Ultimately, understanding those key distinctions, scheduled versus non-scheduled, impairment versus disability, wage loss versus fixed award, that's your starting point. Knowing exactly what documentation is required, especially that well-rationalized medical narrative from a knowledgeable doctor, and then carefully avoiding those common missteps we outlined, those are your strongest tools. Whether it's making sure your doctor clearly defines permanent restrictions or you're strategically timing benefit claims and elections, being proactive and genuinely informed makes all the difference in securing the compensation you are rightfully entitled to under FECA.
Absolutely. And that this knowledge isn't just about navigating bureaucracy. It's really about empowering you, the listener, to manage a system that's supposed to protect the very people who serve our country every day. It's about protecting your income, your family's stability, and ensuring your long-term well-being after a work injury. So as we close out, here's something to think about, a provocative thought perhaps. We've seen how tightly OWCP currently ties non-scheduled compensation to a worker's wage earning capacity, often based on existing physical job markets and how specific the schedule list is for physical impairments. But what might the future hold? Consider the rise of AI and automation potentially changing the very nature of work and earning capacity in many sectors. Or think about the increasing recognition of the long-term cognitive and mental health impacts of certain jobs or injuries. How might these trends challenge or reshape how disability and earning capacity are defined and compensated for federal workers under systems like FECA in the next decade or two? Something